All right, amazing. Thank you so much, Rita. Welcome, everybody. So lovely to see you all here today. So we're going to do labor progression and some comfort measures talk today. So this is part two to the first part that I went through last month. So I just wanted to welcome everybody again. And if you are new here, if you haven't seen my other classes, my name is Zoerina. I'm a registered nurse, and I'm also a certified doula, and a certified childbirth educator as well. I've been doing this work for about 8 years, almost 9 years now. It's my passion. I love it, especially childbirth education. It's something that I really, really, really love to do, and I appreciate teaching new families about birth. All right, so last time we met, we went through the first two stages, the first stage, right? So that was dilation, right? So at this point, we are at the second stage, all right? So we are about to push baby out, okay? So you'll work with your baby and also your body to push baby out here, okay? So this is just what labor looks like from the baby's point of view here. Okay, so as you can see, the baby, waits a little bit, then they get engaged into the pelvis, they descend into the pelvis, eventually into the birth canal. As you can see, pardon me, the baby's head molds to the pelvis. That is called actually molding, and that's what kind of gives them that like little cone-shaped head that they have when they first come out. It's their head forming to your pelvis so it can fit inside of there. Then they'll do an extension once in the birth canal, and they'll do an external rotation where they line up with their shoulders, and one shoulder is delivered at a time. And then we have expulsion after that. Okay, so we are right about here in the extension, external rotation, and expulsion piece of it when we're talking about pushing. Okay, so as you can see, there's a lot of different steps that baby needs to go through to be able to actually be born, right? So that's why, pushing it can take a little bit more time than you might think it might take. And I'm going to go over that in a little bit more detail here. So, stage two pushing, you're fully dilated. So, as we went over before, you go from 0 to 10 centimeters dilated. Your birthing waves actually space out. Okay. So, your contractions, they space out a little bit instead of being what I was talking about before, about 2-ish minutes apart. Here, they're 3 to 5 minutes apart, okay? And that is, in my opinion, Mother Nature's way of just giving you and your baby a little bit of a break from those really intense contractions that you've had during transition, okay? And as you might be able to recall, transition is the transition point between the first stage, which is dilation, to the second stage, which is pushing, where we are right now. They still last for 60 to 90 seconds, so they're still lasting a very long time. And what you would do is you push with your contractions, okay? Many providers and nurses will tell you to do that, especially if you do decide to get a medical intervention like an epidural. Typically, you would be coached when it's time to push. The average length for most pushing stages is 30 minutes to 3 hours. Okay. It can last for one contraction as well. And what that is called a fetal ejection reflex. Okay. So the fetal ejection reflex, I'm going to grab my uterus here. So this is my little uterus model right here. So as you can see right here at the top of the uterus, that is called the fundus, okay? So what happens when you're dilating and when you get to be fully dilated, when dilation is complete, the top of the uterus gets really, really thick, okay? So with that, a contraction can come and eject your baby out of you. So it's called the fetal ejection reflex. It's actually super cool if you ever get a chance to see it. But if you never get to experience it or never get a chance to see it, that's totally fine. But that's what I mean when pushing period can last for one contraction. Doesn't happen too often, but it does happen to some people. Otherwise, if you're a first time mom, on average, you'll push for about an hour on average. Okay, everybody's different. Some people, like I said, will have a pushing period that is one contraction. Some people might have a pushing period that is 3 hours, which is within the realm of normal. I also don't want you to think that if I have a longer pushing period, right? Like if I do push for an hour, I don't want you to think that you're bearing down for a whole hour. That's not exactly what's happening. Typically, what happens there is that you're pushing, okay? And then maybe you're not making a ton of progress, or maybe your provider feels like you just need a little bit more time to have the baby get down a little bit more. And they will tell you, hey, let's take a rest. Let's take a 15-20 minute rest before we try to push again. Okay. So that is where that timing comes into. That's where you see people have a longer pushing periods. I'll also say like 3 hours is not typically very super duper normal, even though it's kind of like within the realm of normal. Some people do push for that long. It's not like very, very common that people push for that long.
It's too long.
It is quite long. But some people do it, some people don't. It all just depends. Um, but I will say most people do not. Okay. So what should you be doing? You should be pushing when you are ready. You will feel the urge to bear down. Okay. It'll be very, very intense. You'll feel like a lot of rectal pressure. All right. So you'll feel pressure. Even if you do have an epidural or any other type of pain medication or not, you will feel that strong urge to bear down. Okay. And you also want to listen to your body. That's why it's so important to tune into your body before you go into labor, right? So it's just easier for you to say, something feels really different right here. It's probably time to push, right? So that's what you want to do, okay? And again, your body will tell you, all right? So I'm gonna go also to the next slide. I'm gonna talk a little bit more about, pardon me, pushing positions, okay? So here we have the different various pushing positions that you can do. These are all images of babies crowning, essentially. Okay, so I'm going to go through each one of these positions. This is the most common one that I see right here, this C position, where your provider will tell you or your nurse will tell you to curve over your baby and bear down. Okay. So I see this one the most. However, in this picture, she's holding up her own legs, but in real life, typically, most likely, two people are on either side of you holding up each one of your legs. Okay. And you can do this position on like a semi-reclining type of position. Like you kind of put the head of the bed up a little bit. You could even do it on your side. So even when you are doing this sideline position, even though you're on your side, you will still be directed to kind of like curve over your baby and push them out that way. Okay, so we're creating like it's called like negative pressure. What we're creating right there. Okay, so that's the most common one I see. These two, the side lying and the hands and knees, is the second most common ones that I see. And we use the side lying if the on your back is not working. We would use the sideline to open up a different area of the pelvis, okay, and to help encourage the baby to come out, okay. And same thing with hands and knees as well. It's just a different position, a gravity neutral position, as you can see right here, that helps the baby navigate the pelvis a little bit better as well, okay. Um, Next we have squatting. So you can even do an assisted squatting. You can get like something called a squat bar that would attach to either side of the bed. And you would hold onto that squat bar and bear down. All right. So that is another option for you. And also standing up is also an option as well. Okay. However, I see the standing up position more often with my out of hospital births than in my in hospital births. So also, just so you know, you can do all of these pushing positions with an epidural. The only thing you cannot do is stand. That's the only thing you cannot do with an epidural, but everything else you can absolutely do that with an epidural. Okay. So these are the most common pushing positions that I see. Um, your body will tell you what to do. So really, really important to be in tune with your body before you go into labor and listen to what your body needs. I've seen people, say, the sideline's not working for me, and they just go on their hands and knees and they just kind of go for it, right? And that's what works for them, and that's where they get the most power from their pushes as well. Okay. So this is just some information about pushing positions. All right, so you push the baby out. Okay. Now we're at stage 3. All right. So stage 3 is when you are delivering the placenta here. All right. So your contractions continue sporadically. So they're just random at this point. The placenta will be delivered in 5 to 20 minutes. In most cases, your provider wants to see your placenta be delivered in about 12 minutes. Okay. And then sometimes your provider will also encourage you to push the placenta out. Of course, you'd be enjoying your baby. Once you push your baby out, they put the baby on your stomach or on your chest, just depending on how long your cord is. Okay. And then they will be doing the assessments and helping you deliver your placenta there. All right. So this is what the placenta looks like. Okay. And remember, baby is attached to the placenta via the umbilical cord. All right. So that's the delivery of the placenta. So what can you do with your placenta? Well, most people discard it. That's what most people do. That's, the average person will do that. Some people donate it. Some hospitals have programs where they'll use placenta tissue for skin grafts. So people who have diabetic ulcers or burn victims, they'll use it for that. So talk to your individual hospitals about what is available to you. And then some people hire a placenta alchemist to either encapsulate it, make keepsakes out of it, placenta arts, or tinctures. So typically you need to have the placenta off of the labor and delivery unit within 1 to 2 hours after you give birth, to be able to take it home. Usually whoever you hire for it, or your support person or your family members, will take it for you. So it's off of the labor and delivering unit within that time, because in between that time, you'll be moved to the postpartum unit, and you can't have the placenta because it's a live organ on the postpartum unit. Okay, so that's why you must get it off quickly, off of the labor and delivery unit. Okay. There's a lot of different reasons why people do this. Some people have certain cultural traditions they want to do with the placenta. Some people want to encapsulate it and consume it. There's not a lot of research on it though. So what they do, this is all anecdotal, what I'm about to say next. Essentially, like, people say it helps them with breastfeeding, helps limit their postpartum depression as well, things like that. So if that's something that you would like to do, definitely get in touch with a local birth worker or placenta encapsulation specialist in your area that knows how to do these things. I've also seen people make really cool keepsakes. I've seen people take the umbilical cord and dip it in 24 karat gold and make it into a little heart and all this stuff, other different cool stuff. So you can get pretty creative with what you end up doing with it. Okay. So that is what you can do with your placenta. You could also collect cord blood as well. That's not super duper common, but some people do it. If you know that certain like cancers and autoimmune diseases run in your family, you could get in touch with either the state government that you live with, or a local cord blood bank, and they will give you a kit to be able to take cord blood with you, and then they'll store it for you. But I would only really recommend that, again, if you have like certain cancers and autoimmune diseases that run in your family, and that's a treatment for that, because there's stem cells in the cord blood that we could use to treat certain diseases. Okay. So that's a little bit more information about that. And the major thing for just overall in birth is to surrender. You want to surrender to the process, okay? This is something that you don't have a bunch of control over. You can prepare for it properly, right? And being here, educating yourself is helping you prepare for it. However, you don't want to be so stuck in, okay, this is exactly how my birth is going to go. I've even heard people, for example, say, like, oh, I'm going to push my baby out in 2 pushes. Well, that might not happen. And you can't be upset that it doesn't happen in the moment, okay? You have to be flexible. You have to lean in to the experience, essentially, okay? So that's my thing that I want you all to take from all of this. So what happens in the immediate postpartum? So you may experience or feel relief, exhaustion. You might be shaky. That's also super duper common. You might also experience some vaginal discomfort. Obviously, you just gave birth to a human being the size of a watermelon, right? So that's uncomfortable. And also abdominal discomfort. The abdomen will be very, very tender. Okay. So your care team is going to do something called a fundal massage. They'll do a fundal check and also a fundal massage. So remember, I showed you on my model, the top of the uterus is the fundus. So we're checking as your healthcare providers. Um, to see if it's firm. It should feel like a grapefruit, okay? If it doesn't feel that way, then we'll do a massage on the uterus. It is not like a massage you get from Massage Envy. It's not comfortable at all, okay? However, it is necessary for you to be able to for us to be able to assess how well your uterus is adapting and shrinking back down to its pre-pregnancy size. That process is called involution. Okay. And we want to make sure that it is doing that because essentially what is happening once you give birth and you deliver the placenta, there is an open wound in your uterus. So where the placenta was, now that area, very vascular area, that had all these blood vessels and everything like that in it, is not attached to anything. So that's where you're getting like the hemorrhaging, the bleeding from. So we have to make sure that the uterus is shrinking back down and making that wound smaller, essentially, and kind of cutting down or cutting off some of that circulation to that wound, okay, by shrinking back down. All right, so that's why we do the fundal massage. That's also why we'll be getting Pitocin, okay, that's synthetic oxytocin. When you are in your third stage, okay, so that is part of the medical management of that third stage, okay. Those that oxytocin is making your uterus go shrink back down, contract and shrink back down to its pre-pregnancy size. Okay. They'll also monitor your bleeding very, very heavily. They measure everything. They measure everything that comes out of you. They measure the sheets, blood on the sheets, and everything. All right, to get an estimated blood loss from you. And they also assess for tears. Okay. If you need stitches, most people, if they do need stitches, need like one or two stitches. It's usually not this like huge, massive tear or anything like that. And those stitches are dissolvable. And they'll also be checking your biosigns pretty frequently after you give birth as well. And again, it's all preventative. We're just trying to manage anything that might occur after. Okay. So that is the immediate postpartum for you, the person who gives birth. And then support during the immediate postpartum. So as a support person, all right, so this is for my support persons that are participating here. If any of you are in here, you want to provide support during the fundal massage because that is incredibly uncomfortable, especially if you don't have very strong medication. Typically, they turn the epidural medication off as soon as you give birth to your baby. So the fundal massage might be a little bit uncomfortable. All right, so making sure that you are there holding her hand. This is again why it's really nice to have more than one support person because while you are there with her holding her hand, then you can have another person watching the baby if the baby is at the warmer. All right. So of course, encourage the person who gave birth to drink some juice. Definitely do that. They just lost a lot of blood, and they might feel fine. They're like, oh, I'm fine. I don't need any juice, but kind of want to be like insistent upon drinking it. Okay. It's gonna help hydrate them and help them with that transition. Also, a lot of people by the time they hit like active labor, they don't really want to eat at all or consume anything at all. So having a little bit of something like sweet, giving you some calories can really help you out there as you transition to no longer being pregnant. And of course, be present. This is a really important time as well. All right, so now we're going to go to the immediate postpartum for baby. So your care team will give your baby something called an APGAR score. So an APGAR score is a score from 0 to 10 that assesses the well-being of your baby, okay? It tells us how well they are transitioning to no longer being attached to you. So the APGAR, the letters stand for appearance, pulse, grimace. So that's like their muscle tone, like how they react to certain things. Activity, are they moving around a lot? And also respiratory rate. Each letter gives the baby 2 points. Most babies get about an 8 or a 9 when they first come out. Okay, so that is normal if they get like an 8 or a 9. They'll also suction the baby. also get the weight and length of the baby. So these are the only two things that they cannot do while the baby is on you. All right. So for them to get the weight and length, they have to take the baby away, put them on the warmer. If you want the full golden hour, then you would tell them to wait. And most hospitals, most providers are cool with that. They'll just let you do the full whole entire hour for that with the baby with skin to skin, and then they'll come back and do the weight and length later. We also have the vitamin K shot. So the vitamin K is a vitamin that we give to babies because babies are not born with a lot of vitamin K. It does not pass the placental barrier very well. It's also not readily available in breast milk either or formula. So what we do is we give the baby a shot of vitamin K, and this is essential to help with their clotting cascade. Okay, so vitamin K helps us heal. So when you get a boo boo, you get a cut, the blood rushes to that area, and your body starts to heal. Vitamin K helps in that process. It is needed for that process, and also babies don't have mature guts or mature livers, and those are also sources of vitamin K. And babies don't have the ability to kind of metabolize it themselves either. So this is a preventative measure to help prevent something called vitamin K deficiency hemorrhaging. All right. So they did a study, like I think at this point, like about 60, 70 years ago, where they found that babies who did get the vitamin K shot had less incidences of that hemorrhaging that I was talking about in their internal organs than the babies who did not get it. Okay. Now, it's still incredibly rare either way. However, the rates of it decrease significantly when babies do get that shot. Okay. So that's the reason why they do that. Next is a PKU test. So the PKU test is just a little heel prick. They'll prick the baby's heel and they'll put the blood on some paper. And that tests the baby's metabolism, tests to see if they have like any major metabolic issues. Hep B vaccine, so that's something that will be offered to your baby as well, and or to prevent them from getting Hep B. And erythromycin. Okay, erythromycin is antibiotic ointment they put on the baby's eyes. I don't know if you've ever seen pictures of babies when they're with those newborn pictures and their eyes are all shiny. It's not because they're born that way. They put erythromycin antibiotic ointment onto their eyes, okay, to prevent any sort of infection in the eyes. All right. So that is what they do in the immediate postpartum. All this stuff is happening very, very quickly, like within about the first 30 to 45 minutes of the baby being born. All right. And they'll ask you these questions. They don't just do these things, they do ask you if you're okay with these things as well. Okay. All right. The golden hour. So don't disturb the new family. Consider delaying all newborn procedures that cannot be done on you, like I was talking about before. So if you do want a full golden hour, then you would delay the weight and the length. But of course, a heel prick, a shot, vaccine, all those things can be done while the baby's on you. And it might be more beneficial for that to be done on you. Babies are anxious, and birth is kind of traumatizing for them as well. If you think about it, they were inside of you, they were in the amniotic sac, swimming around, having a good time, listening to your heart rate, relaxing, and all of a sudden they come out here and it's loud and the lights are super bright. It's overwhelming for them, right? So having them on your chest, having them do skin to skin with you really calms them down. It makes them feel really safe. They love the sound of your heartbeat. They've been used to it this whole entire time. That's what they've been listening to the whole entire time. And also your temperature, your body temperature goes up by like a degree or two. Okay. And that really helps them with their temperature as well. It keeps them warm. So you are the warmer, right? We do have warmers in hospitals, of course, right? Those are necessary, but you also are the warmer as well. Okay. Initiation of breastfeeding also happens here, and eat please as well as soon as you give birth if you are able to, and of course complete any cultural and religious traditions if you do have that. Certain religions have certain things that they do as soon as the baby is born. Okay, so that is something that you would complete at that time. Okay. So that's just a little bit about the golden hour. Very, very essential. And if you can't do skin to skin, have somebody else do it. Have, your primary support person do it, whether, it's your mom, your cousin, your partner, whoever it is. Have them do skin to skin if you can't do it at that time. All right. So I want y'all to sound up in to the chat. What would be your first post-birth meal? Have you thought about what you wanted in your first post-birth meal? Steak. Oh, I love that. Jennifer, I love how you just knew.
It's my
Sarah said
favorite.
sushi. I love steak too. Eggs. Oh, that's so interesting. I've never had anybody say eggs. I love that. And if you haven't thought about it, you should think about it. You will be able to eat whatever you want because you deserve it. Birth is super duper hard work. All right. I also see beans. Oh, that's great. Oh, I love it. Okay, cool. Y'all have some interesting tastes.
Also, Starks said sushi, so
Yeah. Oh, yes, I see. Oh, yes, Star says sushi. Oh, yes. Yes. Oh, lovely. Love it. Ninth, Sydney said rare steak I can have, blue if needed. Super rare steak. I love it. Okay. Yes, and the sushi. Yes. Have y'all seen those like Instagram or like also on TikTok too? They have those huge boats of sushi. I know they're not eating all of that. It's just one person. How could you possibly eat all that sushi? But people do that. Okay. Any questions about anything I said so far? See seafood. Yeah. Oh, I would love a seafood boil. That's a good one. All right. You can also save questions for the end as well if you feel like you have any. Now I'm going to touch on some like comfort measures. So this is going to be like a mixture of like your environment, how it should look like, and also like some movements that you can do while you're in labor. So I want you to think about what your ideal birth will look like. Who is there and what are they doing, right? Is your ideal birth in a birth center or is it in a hospital or is it, at home? Some people do give birth at home, think about what that'll look like and think about who is going to be there. That's very, very, very important. Okay. Who is going to be there? Your environment really, really matters when you are in labor. Okay. It's not just like the stuff that's in there, it's the people who are in there as well. Okay. So who will be at your birth? Typically your providers. So these are just different types of providers. We have, maternal fetal medicine specialists. We have midwives. We have doctors. We have nurse practitioners, so it all depends on what you decided prenatally, what you want to go with. And then that person would be there. Now, I do want to also say that your provider is not really like in the room with you when you're laboring. Okay. They're mostly just kind of like to the side monitoring things. If you see your provider a lot when you're in labor, that's not so good. Okay. Because now like things have escalated and now you need more management of your labor. Okay. So you should pretty much largely be alone during your labor as far as the provider goes. So that's your provider. So your provider is super important. If you feel like right now your provider doesn't listen to you, you don't feel comfortable with them, you get nervous when they're in the room with you, and maybe you should probably switch providers, right? If you can, if that's a possibility for you. I know some people can't, but either find a way to cope with that or, get a different provider. Who else will be there? You can have, your doula, you could have your cousin, your mom, your auntie, of course, the father of the baby, whether that's your partner, your husband, whoever, your boyfriend, whoever it is, they would be there as well. Most hospitals allow at least about two people into the hospital with you. So find out what the visitor policies are. Some hospitals don't include a doula as your as a support person. They would say like, oh, you're allowed to have two support people. If you have a third one, then it must be a doula. I definitely highly recommend you have at least two people in the room with you because that they'll be able to circulate with the comfort measures, right? They'll be able to really, really help you out with all those comfort measures. And if you missed my previous educational sessions. A doula is just a professional support person that helps you with advocacy support, emotional support, and physical support while you're in labor. Okay. So how do you get a doula? You can do a Google search. Very, very straightforward and very, very easy. Also, organizations like DONA and also NBDA have lists or registries of doulas that would be in your area. You can also join a local doula or mom Facebook group and ask for recommendations there. And you can also call your insurance. They may cover your care or use your flexible spending account or health spending account to pay for your doula. So you don't necessarily need to come out of pocket for a doula, right? It's great if you could do that. That's amazing. Some people can't. So I love going over this just to know that doulas are accessible, right? They're more accessible than you think. It's not something that's luxurious. A lot of people think like, oh, you have to be rich to get a doula. You have to, sorry, sorry. I was doing with my microphone. I think everybody can hear me now. Yeah, some people think you need to come out of pocket like $2,000, $3,000. Not necessarily. A lot of the times, your benefits do cover that. Okay, especially in certain states, they have dual support as a benefit under Medicaid. I also want you to ask you all, did you think about your birth wishes and what are some aspects of it, right? Have you thought about what your desires are for your birth? Everybody, we all know like everybody wants to come out healthy, they want the baby to be healthy, of course. But what are some other things? Do you want certain music to be played? Do you want a certain aroma in the room, right? Um, I'm gonna talk a little bit more about like the characteristics of a good birth plan or birth wishes. I like to call birth plans birth wishes because you can't really plan a birth, right? Most likely it's not gonna go exactly how you said it's gonna go in that moment, but it will go, that what it is a tool for you to understand what is and what is not important to you. Okay. So you want your birth plan to be clear and concise. Okay. So you want it to be, you want somebody to read it or your provider to read it and say, oh, I know exactly what your desires are. Also want to review it with your support team. So not just your doctor or your midwife. You also want to review it with anybody else who's going to be in the room with you. So if your mom is going to be in the room with you, if your cousin, if your partner, everybody should know what your desires are. You also want it to be flexible. You should have like a plan A, B, and C. Okay. So plan A is like, oh, this is perfect. This is exactly what I want. Plan B, maybe if you need to add some other interventions into your birth. And plan C is, oh, emergency situation. What would I want to happen in an emergency situation? Okay. So that's why I say build flexibility into your plan. All right. We're going to talk a little bit more about birth planning topics in our next session. I find that people get the most out of birth planning and me talking about it when we get to our our medical interventions. So, how do you achieve the birth you desire? Proper measures, right? So super duper 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 important for you to know your comfort measures, understand what works for you. You should have like a group of like 4 to 5 different things that you can do while you're in labor to bring you comfort. Whether you have an epidural or not, this is still going to be important. When you have an epidural, for most people, they can still feel pressure. Okay. So you still want to learn how to breathe through the discomfort of the contractions. All right. I'm going to talk about a lot of different things you can do to bring you comfort. Everybody thinks like, oh, you either gotta like, be miserable or get an epidural. That's what a lot of people think, but that's not true. You can find different ways to cope with the discomforts of labor. First, I'm going to talk about the gate control theory. So, what the gate control theory is essentially saying that the pathway for pain is smaller and shorter, right? And not and it's slower than the pathway for pleasure. Okay. So the pleasure pathway is big and large and fast. So if we do things that are pleasurable to you while you're in labor, like we give you a massage or we give you counter pressure or you smell something nice in the room, that will reach your brain before the pain does, and that changes your perception of the pain. Okay. So here's a little bit about your birth environment. All right. So pleasurable things, right? Aromatherapy. If you're going to use aromatherapy, I don't suggest a diffuser. I would suggest you, if you're going to use an essential oil, to put it on a napkin or a tissue and pin it to your clothes or put it next to you instead of having it permeate the whole entire room. If it permeates the whole entire room, you might get to a different stage or phase in labor and no longer like that smell. And you can't open the windows wide in a hospital. Obviously, if you're at home, it's easier to do that. But in other birth settings, not so much. All right. So if you're going to use that, use it that way. I find that a lot of people like lavender when they're in labor. Inspiring art. A lot of the times, actually, why part of the reason why I love bathrooms or using the bathroom for my patients or my clients who are in labor, I love that the bathrooms typically have art in them, and you can use that as like a focal point. So you can focus on the art, and get through the contraction and breathe through the contraction. Okay. Affirmation cards, you can make those. I had one client who had her everybody at her baby shower write down an affirmation for her, and I cut them up and I put them in a jar, and every time she was going through a contraction or she was having a difficult time, we took one out and we read it to her, and that really brought her a lot of comfort while she was in labor. Next, we have a birthing ball. Most hospitals have access to a birthing ball or a peanut ball or some sort of balls to help your labor progress and make it a little bit easier for you to change your position. And it can also help shorten labor because it keeps you moving. Okay, so using that to your advantage is very important as well. We also have music as well. So doesn't necessarily have to be music. It can also be, just a prayer or relax or static or a relaxing sound to you. It doesn't have to be music. So a lot of people will have, like fun dance music in the beginning of their labor, and then as it gets more serious and active labor, and in transition, they play like maybe classical music or something that calms them down a little bit more. So you tap into that, find out what you like, make a labor playlist. It's going to help you, make you excited while you are in labor. Okay, helps you relax. And then also lights. I bring little tea candles to my births. So you can bring those and or you can like hang up lights, you can tape them up on the walls. Again, it's just setting a mood, right? You're gonna have dim lights in the room. It's best to have dim lights because the dim lights help your body release something called melatonin, and melatonin helps enhance the release of oxytocin. Remember, oxytocin makes you have contractions. Okay, so dimming the lights, I know you've probably seen it in like labor videos and things like that. That really helps enhance your whole entire experience. Okay, it helps you progress. So that's another thing as well that you can do. Comfort for your primary support person. So having more than one support person with you so they can share in the load of, taking care of you, making sure you're okay, and making sure that you are always comforted. Find a way to cope with seeing someone you care about in pain. This is a major one, okay? A lot of people see somebody they care about and love in pain and they freeze. They're like, oh my God, I don't know what to do. I'm scared. Okay. I've seen many a dad sit in a corner and just like stare like this and like not know what to do. All right. So you have to find a way to cope with it and push through it so you're able to help her, right? To help her with those discomforts. Find ways to stay awake as well. I like caffeine. When I go to my births, like as a doula, I'm using caffeine to stay up. Okay. That really, really helps me to be able to, show up full 100% for my clients. Rest when she's resting. Okay. So if she's active and she's up and she's moving around, that is when you're active, you're helping her, you're making sure she has ice chips, you're doing counter pressure, you're doing all the things for her. If you are if she's resting, then that's when you go to sleep. Okay. And then bring comfort necessities as well, right? If you have a specific pillow, I like to bring a neck pillow and a sleeping bag to all my births because I get cold. And also I have neck issues, so I bring my little neck pillow to help me out. So think about using those things too as far as like packing for the support person. I'm going to get into physical comfort measures. So, massage and counter pressure. Massage again takes control or takes advantage of that gate control theory that I was talking about. Okay. The counter pressure really also helps with that too. So you're counteracting the pressure that the baby's putting on the pelvis. So as you can see, we have counter pressure on the tailbone. We also have on the foot massage. Foot massage, there are nerve endings that connect from the bottom of your feet all the way up to your pelvis and your lower back. That's why a lot of people who have jobs where they stand up all the time, on the field all the time, have back problems because they're always on their feet. So use that to your advantage. You should have, again, like 4 to 5 different things you can do while you're in labor to help cope. And you should change it every 20 to 30 minutes because after about 20 minutes, your body gets used to it. It gets used to that feeling. Okay. So that's why every 20 to 30 minutes, you're switching out. Okay. So use that to your advantage. All right. And also, even you can also use the shower as well as a massager. Okay. And also the tub is also really useful here too. So it's hydrotherapy. So the shower right here and the tub. You can use the shower as a massager, and then the tub helps with lifting up the baby off of your back and off of your pelvis. Most hospitals don't have tubs in them, but at your home, most likely you do have a tub. So use that while you're at home and you're laboring at home in early labor. Here we have, I'm going to talk a little bit more about counter pressure. So I already talked to you about the tailbone counter pressure right here. You can also do counter pressure on the hips right here. So right below the crest right here is where you do something called a double hip squeeze. So right here, as you can see like in this little animation right here, she has gone right below where the crest of the hip is, and she squeezes the butt cheeks together. That motion was counteract the pressure and the weight of the baby. Okay. So this is super duper 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 helpful while you're having a contraction. It's a static movement. So you hold it for the whole contraction. There's tons of videos and examples of this on YouTube. If you just look up double hip squeeze or counter pressure on YouTube, you and your support people should absolutely practice doing this before you go into labor. It's going to really, really help you cope with those contractions. I also went through a little bit of this hydrotherapy and thermotherapy. So hot and cold packs are available at all birthing locations. They have those little squeezable ice packs and hot packs that you can use. And I already talked about the importance of using the tub and also the shower as well. That can really, really help you get through your contractions. Again, this works as a massager, and this helps lift the baby off of your back and off of your pelvis to make you a little bit easier for you to cope with the contractions. Okay, you'll most likely do this at home. And you can do this, the shower, at home or at the hospital because all hospitals have showers. Okay. All right, now we're going to talk a little bit about positions of labor, and then we will close. So here we have here we have your pelvis. Okay. So remember, I talked about the different levels of your pelvis. I'm going to show you a few things you can do depending on where your baby is in the pelvis. So remember, we go from like -4 all the way up to +4. So +4 is essentially like the baby's in the birth canal about to be born. And then -4 is the baby hovering above the pelvis. Okay, that's station, that's fetal station. So opening up the inlet. So doing abdominal lifting and tucking, and dangling. You can see these are dangling movements. You're using gravity to encourage the baby to get into the pelvis, right? So that would be anywhere from like -2 station and up. So -2, -3, and -4 station. Okay. So you use a dangling position to use gravity to help baby to get down. And you can also use an abdominal lift and tuck to help encourage the baby to get down as well. Okay. Here we have opening the mid pelvis. So typically when you're opening the mid pelvis, which is about -2 to +2 station, and right there, you will also feel vaginal pressure. If the baby's in that mid pelvis, you'll feel a lot of vaginal pressure. You want to open up the pelvis side to side. Okay, so side to side. So you could use a peanut ball, like I was talking about before. It's a little figure-8 ball, all right, that you can put in between your legs to keep the pelvis open even if you're resting. As you can see, she is laying down and she's a little bit more comfortable. She has this peanut ball. You can also lunge as well. This is also really great, again, to open up the pelvis, room in the pelvis side to side. Okay. Next and final thing we're going to talk about is opening the outlet and pushing. All right. So Opening up the outlet, you can sit on the toilet. Now, sitting on the toilet is not super duper comfortable when you're in labor, but it will help you with cervical change. Your cervix will change on the toilet. We naturally relax our pelvic floors on the toilet. Okay. So that's why I say it's so important, especially if you've got like a couple more centimeters to go, like you need like, two more, like you're already at like centimeters and you just need like two more centimeters. It's really, really great to get you there. Even in earlier in labor, you should be going on the toilet and having contractions on the toilet. It'll help you progress. Okay. And then I already talked about the side lying pushing. And also, this is a squatting position. This is a supported squat. Okay. This is also really great to push baby out here. And that is it. Any follow-up questions for me at all?
If you have any questions, you can feel free to unmute your mic or you can drop them in the chat.
Hi, good evening. I'm Shalon.
Hey.
Thank you so much for this presentation. I didn't make it to part one, so I'm going to look on YouTube for that one.
Yeah.
But my question is, are you located in Maryland? You're very knowledgeable and you just seem very pleasant. And
Oh, thank you.
so
I
you're welcome.
actually I actually live in Northern Virginia. So yeah,
Okay. So
very
do
close.
you work with people in like PG County or anything like
Yeah,
that?
I
Okay.
do.
Okay, so maybe put your contact information in
Yeah,
the
I
because
always
I'm looking
do.
for a doula and I don't know how this process works. My primary care doctor and my OB gave me a packet of them, but it was a bit overwhelming.
Oh, wow.
Mhm.
Um, and so I just was like going through that, but then I kind of stopped. But I would definitely like a doula. So
Yeah, yeah.
and yes,
I also, thank you.
you're
That is really
welcome.
sweet. Thank you for the great compliment. I also manage a doula network. So if I'm not available, there's a bunch of doulas in Maryland who I know. Like I know like 100 doulas like in Maryland. So yeah, I could definitely, I don't mind helping you. My email is in the chat, and that goes for anybody. You can reach out to me via email. Absolutely.
And I also dropped the YouTube link in there for you, Starks, if you wanted to go and go look at the other videos, the classes that record the past classes that we've done. Okay?
Yes, thank you kindly.
You're welcome.
Yes. Any other questions for me?
So on average, how long does, I know it really depends with the person, but on average, like how long do you say like labor will be and things like that? Because I'm really
Yeah.
terrified of labor right now.
Yeah. Well, I'm sorry to hear that you're terrified. Well, on average, for most people, anywhere from 12 to 24 hours on average. However, like I said before, like you said, you remembered what I said, it's like sometimes you can be in early labor for a few days, and then your active labor might last like, about 8 hours, and then your transition that lasts a couple hours. So like it all depends, but on average about 12 to 24 hours for most people. Um,
Okay.
and if you're, I would definitely encourage you to listen to like some hypnobirthing tracks, hypnobabies, hypnobirthing, to give yourself some affirmations before you go into labor to help you, like help with your fear. And fear about birth is normal. This is not something that, we do every single day, right? Or especially if this is your first baby. So definitely try to lean into some affirmations for yourself to help you out a little bit. Okay.
Good question. Good.
Okay, I started yoga so I can help with like the pushing process and everything like that so far. So
Good.
Good, good. Great question. Any
Yes.
other questions?
And if you go back, we do have two sessions. We have a class. We talked about the skin to skin. It's on our YouTube channel. And then we also talked about sound birthing. So you can go back and they're on there. And we're going to
That's
bring back
amazing.
Lisa. Yeah, with the golden hour, it was a phenomenal class. So she's going to be coming back to kind of talk about that as well.
Great. That's amazing. Any other questions? Yeah.
I'm
Okay.
going to stop the recording.
Yes. Thank you for coming, everybody.